A mallet toe is a condition that has been described as a similarity to a hammer toe, but not exactly the same as a hammer toe. A mallet toe describes a deformity of the end joint of the toe, which, if you imagine a toe having three separate bones and two joints, the end joint of the toe is the one at the very tip of the toe. And a mallet toe is where that joint starts to actually flex or become stuck in a bent position. And a mallet toe can cause pressure both at the tip of the toe underneath, and it can also cause pressure at the top of that toe where that bend occurs, and can cause calluses, as well as, in some instances, even ulcerations or holes develop in the toe because of the pressure that's created. In addition, mallet toes can cause pain in the joint where that toe has become deformed. If you have a mallet toe, because you're noticing that deformity, this can be treated at home by the use of different pads or callus removers to help to prevent pressure problems, spacers between toes. Tape can be occasionally effective in trying to realign the toe, and then also creating room in your shoe so the toe doesn't have friction. So using a deep toe box or a wide toe box shoe is very effective for this. If you're not able to treat those symptoms at home adequately to your satisfaction, then I recommend that you see your foot doctor. Your foot doctor will typically take an x-ray of your foot and determine whether or not this is truly a mallet toe or maybe even arthritis of that joint. And then once that's determined, we'll suggest some of those same home remedies potentially that you've discussed, show you ways to tape the toe, and then recommend appropriate shoes for you to wear. If not effective, then the final stage in treatment for mallet toe is surgery. And surgery for mallet toe typically involves removal of the joints on that toe. So usually the base of that little bone at the tip of the toe and the end of the middle bone are removed with a saw in some instances, and then allowed to be pushed together, and then a pin is placed across that and creates a fusion between those two bones. When the fusion occurs, the toe remains straight, becomes a little stiffer at the tip, but the pain resolves. The surgery is effective at least 90% of the time when done correctly. And I would recommend considering that possibility. In addition to the fusion, sometimes when the toe is still flexible, just releasing the tendon to the tip of the toe can very effectively resolve these symptoms and allow the toe to straighten out. That can also be done in the office and not even necessarily in a surgical suite, and can be very effective as well. Your doctor will need to make the decision between these options before making a choice on what type of surgery would be appropriate for you.